common patient complaint is often excess skin or bags underneath the lower eyelids. There actually are several different ways to address this area. Again, there are non-invasive options which include the use of fillers to help kind of smooth the transition between the lower eyelids and the upper cheek. So that's good in certain candidates who have really good skin tone. Then there's also non-invasive devices that can help tighten the skin of the lower eyelid, or even a CO2 laser, which is a type of laser that really stimulates collagen rejuvenation to help tighten the lower eyelids. In the case where there's a lot of bulging tissue underneath the eye, then traditionally surgery is recommended. In those cases, what we often will do is make an incision just along the lower eyelid and remove fat at the same time as using that fat to help cover up the transition between the lower eyelid and the upper cheek, making that transition look more natural and smooth. Simultaneously, what we'll also do is remove a little bit of skin, again to help redrape or reshape that lower eyelid to give you a more restored and natural look.